Okay, so good day. My report today is about celiac disease. By the way, I'm Orlane Maribel D. Maunahan, RN. So first, what are the contents? The definition, statistics of the disease, causes, signs and symptoms, diagnosis, treatment, nursing management, and the journal or the evidence-based nursing. First, the definition. Celiac disease is an inherited lifelong intolerance to gluten. Gluten is the protein found in wheat, rye, and barley. A few statistics. Celiac disease is the most common genetically induced food intolerance worldwide. The prevalence around 1% and growing. Wheat is among the 10 most common allergens responsible for food allergy. Here you can see at the map the countries with the prevalence of celiac disease. First, the blue one here, 1 is to 50 to 1 is to 500, like the Australia, the Iran, and the Turkey. The orange one, 1 is to 500 to 1 is to 20,000, like India. Then the green one, like Japan here, is less than 1 is to 20,000, and the violet one are the unknown, like the China and the Philippines, unknown in majority or the other countries. Next, what is celiac disease? It is an autoimmune digestive disease that damages the villi of the small intestine and interferes with the absorption of the nutrients of the food. Eating gluten triggers an immune response in the small intestine producing inflammation. It is estimated that over half of those who have this disease are undiagnosed or misdiagnosed. 6 to 10 years is the average time of a person waits to be correctly diagnosed. Here you can see the duodenum, the jejunum, and the ileum. Here in the small intestines where celiac disease occurs. Next, the progression of this disease. Here in the left side, you can see the normal one. At the middle, it's the partial atrophy. And at the right side, it's the total atrophy of the disease. Next, what's the role of the environment in influencing the development of the celiac disease? First is the risk increased by repeated rotavirus infections, gluten induced in first 3 months of life, gluten induced in large amounts, while risk decreased by prolonged breastfeeding, introduction of gluten during breastfeeding, introduction of gluten in right time window and in low amounts. So what's the celiac disease? It is an unique autoimmune disorder because both the environmental trigger gluten and the autoantigen like tissue transglutaminase are known. Elimination of the environmental trigger gluten leads to a complete resolution of the disease. So here you can see the celiac iceberg. At the bottom, you can see the latent celiac disease. It's the normal mucosa. And at the middle is the silent celiac disease. And at the top portion of the iceberg is the symptomatic celiac disease. It is manifest by mucosal lesion. Next is what are the gastrointestinal manifestations, either classic or typical. Its most common age of presentation, 6 to 24 months, but anyone with the symptoms should be screened, like the chronic or recurrent diarrhea, abdominal distension, anorexia, failure to thrive or weight loss, abdominal pain, vomiting, constipation, and irritability. Here you can see at the two pictures the classic celiac disease and the common features of celiac disease. For celiac disease with atypical symptoms, non-gastrointestinal manifestation, most common age of presentation older child to adult. So here you can see the list of manifestations like dermatitis, dental enamel hypoplasia, osteoporosis, short stature, delayed puberty, ataxia, chronic fatigue, overweight, hepatitis, arthritis, epilepsy, and behavioral with depression. While silent or asymptomatic, it is most commonly diagnosed in those who also have type 1 diabetes, selective IgA deficiency, Down syndrome, Turner syndrome, Williams syndrome, autoimmune thyroiditis at first degree relative with celiac disease. What are the diagnoses? It confirms diagnosis before treating. Diagnosis of celiac disease mandates a strict gluten-free diet for life. Following the diet is not easy. Failure to treat has potential long-term adverse health consequences, increased morbidity, and also mortality. Then for the diagnosis, we have the blood test, endoscopy, complete resolution of symptoms on a gluten-free diet, and genetic testing available. A negative predictor that is much of the population carries the genes for celiac disease, but not everyone gets it. For the treatment, only treatment for celiac disease is a GFD or what we call gluten-free diet. It's strict lifelong diet. Avoid gluten found in wheat, rye, and barley. Here you can see the gluten-free diet plate. The red one you can see are the fruits. The green one are the vegetables, the orange one are the grains, and the violet one are the proteins, as well as the dairy with the blue one. You can see also the servings per day and examples of each one. Again, this is the gluten-free diet plate. Next, what are the nursing management for patient and family teaching? You have maintenance of gluten-free diet, refer the patient, the family members to the Celiac Sprue Association. It is helpful for recipes and suggestions. Then patients need continuous encouragement and motivation to continue the gluten-free diet to prevent recurrence of intestinal damage and development complications. Here is the sample of the updated journal related to celiac disease, or celiac disease is also known as Sprue. Clinical Management. Here is the title of the journal, ACG Clinical Guidelines, Diagnosis and Management of Celiac Disease. Author Rubio Tapia et al. 2013. Let's know about the brief description of that journal or the abstract. This guideline presents recommendation for the diagnosis and management of patients with celiac disease. Again, celiac disease is an immune-based to the dietary gluten storage protein for wheat, barley, and rye. So it has been a substantial increase in the prevalence of celiac disease over in the last 50 years and an increase in the rate of diagnosis in the last 10 years. So celiac disease can present again with many symptoms like typical gastrointestinal symptoms. Here are the samples that I tackled a while ago, and also gastrointestinal abnormalities. Many individuals with celiac disease may have no symptoms at all. Celiac disease is usually detected by serologic testing of celiac-specific antibodies. The diagnosis is confirmed by duodenal mucosal biopsies. Both serology and biopsy should be performed on a gluten-containing diet. So again, the treatment for celiac disease is primarily a GFD or the gluten-free diet, which requires significant patient education, motivation, and follow-up. In addition, evaluation for disorders associated with celiac disease that could cause persistent symptoms, like these symptoms. Newer therapeutic modalities are being studied in clinical trials but are not yet approved for use in practice. So here are my reference. Again, for my journal, Rubio Tapia et al. Retrieved from this link. And here are the other references. Again, my report is about celiac disease. Thank you and God bless.